Hello, and welcome to our podcast series, Conversations with KidsPeace. I'm Bob Martin. It's a rite of passage through childhood that most of us can remember as if it happened just yesterday, our first trip to the dentist. Sometimes it can be traumatic. Sometimes it can be anticlimactic. And sometimes when you get that wonderful verdict of no cavities today, it can seem victorious. Whatever the outcome, at some level, you understood that this would be something you would be doing again and again throughout your life. Now, you might think that a child in a residential mental health treatment program would be especially reluctant to sit in the dentist chair. But that's not the experience of Dr. Andrea DiPaul, the dentist who is serving KidsPeace clients at our Orchard Hills campus in Pennsylvania. Dr. DiPaul joined us on the podcast to share how she was, in a way, destined to be in the field she's in, and also how she's helping kids for whom she may be the first dentist of their lives. Here's our conversation. Dr. Andrea DiPaul, thank you for joining us. I really appreciate you coming in and talk to us today.
Absolute pleasure to be here.
So let's start with, at the beginning, how did you come to be working with children in this field?
Okay. I first have to talk about how I ended up in dentistry and my first experience at the dentist. So when I was in about second grade, I had a mouthful of cavities and a lot of pain. And my mom had a set of dentures. Oral health was not at the top of the priority list there. As a result, we were struggling financially. We did not have dental insurance, so she had the daunting task of trying to find someone to see and treat me. She did find a dentist, but when you walk in there as a kid, you know if you're not going to be able to pay for those services for the day. It's embarrassing, and I'm in pain. My mom's worried. You're internalizing all of this. I will never forget this dentist. He brought me into the clinic. He took care of all of my pain. He made me feel good. He did not make it a shameful experience. That was the most important thing. And just truly, he treated my mother and I like we were his most important patients, customers of the day type thing. So for me, I had the best experience. I loved going to the dentist from that point forward. Now, my mom wouldn't accept any treatment for free. She was a very prideful woman, so we got to clean his dental office. And that was exciting for someone in second grade because it was like opening up the door to the secret garden because you're there after hours. So again, I was completely enamored and just thought it was great.
And there's always so many wonderful things that look at this. Look at what I've never seen anything like this.
Yeah, probably things I shouldn't have been playing with, but I totally did. It's okay. So, before I came to KidsPeace, I was trying to find my dental home, we'll say. And you're on Indeed, right? You're looking for, I have my beautiful 5-month-old baby at this point, and I'm trying to see what my next steps in life are. Never heard of anything about KidsPeace. So I'm reading about it. I'm looking at the mission, looking what KidsPeace treats. And I'm like, I really think that this might be a place that I can make a difference in my field. And as a dentist, you wouldn't think you could find that, right? We have a completely different skill set. And I was a little nervous at first, but within 2 weeks of being here, I realized that it was a full circle moment and I found my dental home. So
that's wonderful.
Yeah, that was just, I truly value everything I do here at KidsPeace, but that's how.
I'm sure you feel lucky. People are always looking for their home for their field and everything to be able to find it. That's wonderful.
Exactly.
Now, we've been told that, I want to say more often than not, but certainly often, you're seeing kids who have never been to the dentist before. And we're not talking about 5-year-olds. We're talking, 13-year-olds.
Yes.
How do you approach working with kids for whom this might be their first dental care experience? Yes.
Right. Well, the first thing that I'm going to do is when you walk into my office is going to be warm, inviting, and safe. Those are the 3 things that are at the forefront of my mind. You come into the office, there's going to be a fun movie playing. Like in a couple of weeks, it's going to be The Grinch. We have Super Mario Brothers. They are going to sit in the office, and it's really going to take that anxiety down, bring the heart rate down. We're not going to just put them in the chair and start treatment. And then I have 2 different ways of doing treatment when they haven't seen a dentist. So for instance, with I call my littles, my younger ones, 10 and younger. I have a play set for the kiddos. It's by Melissa and Doug. I don't know if you've heard that from the kiddos, but they can go and they can pretend that they're drilling on the teeth. They can play dentist. And then I have this stuffed animal that has this amazing set of teeth, and they show me how they brush Buddy, we call him Mr. Buddy, his teeth, what they can do to get to so that he can have better teeth. Then we have a tell, show, do method. So we're going to put them in the chair. I'm going to say we're going to go for a magic carpet ride, and they're going to slowly go back. And I'm going to tell them what I'm going to do, how, and everything. I give them my mirror. I want them to touch a mirror to know it's safe. I'm not going to hurt them. And then the showing is everything that I am going to use on my tray. I use on my fingernail, and then I show them on their fingernail, my prophy angle, anything I do. And then we go ahead and get into the nitty gritty. Now, I believe in positive enforcement for the little kids. So as a result, I'm going to say, hey, if you cooperate, we're going to give you a prize. It's going to be great. But I try to do a team effort, and I've contacted the units. So the prizes that we do give are those, fidget type things that they can use as coping skills when they're struggling at the unit.
So they're intersecting with what they're getting
Yes,
at the other parts of their treatment.
Exactly. And so and they really like that. Like I have different mazes, like just different things that they can utilize at the unit as well. And also it just entices them to want to come back to the dentist. Now for my teenagers, a teenager, no matter what, they are grown. They know everything. And most people don't want to like going to the dentist, right? It's not a fun experience. So they're going to come in, I don't want to do this. I don't know why I'm here. So the thing that I really do is I validate their feelings. I go, yeah, I understand. I sometimes don't want to go to the dentist either. I totally understand why you don't want to be here. And I'll even explain, I know the x-rays we take are uncomfortable. They pinch. And at some point, I hope that we can find something that's a little smoother. But let me explain to you why I want to treat you today and how I can take care of your teeth. And the other thing that I do that seems to work that I never did before in my career until I came to KidsPeace is if they're really just resistant to treatment, I go, you don't have to get this done today. I'm not going to force you to do a single thing. And when I put that ball in their court that they can make a choice and have a choice, which I don't think a lot of times as a teenager you get, and especially at KidsPeace, it's in a controlled setting, they 9 times out of 10 say, let's just get it done today. And I have very, very few refusals. So ends up being a great experience.
You had mentioned that like in the rewards area, you've got things that can be relevant to the work that they're doing in their houses, on their floors, et cetera. Do you find that there are connections between issues of dental health and the types of mental and behavioral health challenges that the kids are presenting, their rationale for being with us at KidsPeace?
Yeah, absolutely. So, oral health is definitely going to have a direct correlation with mental health. Your self-esteem is going to be negative. If you have cavities in the front, what's the first thing you're going to do? Shield your mouth. You do not want anyone to look at you. It's a vanity aspect, especially as a teenager. It's embarrassing. So you're going to have increase of depressive symptoms. Another thing, I have our kids come in sometimes and they'll say, I had someone making fun of me because I have bad breath. And again, poor oral hygiene is going to lead to that. So that's that social anxiety. And again, what do you not want to do? You're not going to want to talk. You're not going to want to be your authentic self if you feel like everyone is going to be making fun of you for having bad breath. The other thing is if you're in pain, I truly don't think that you can work on your own self and really get to the bottom of what you need if all you can focus on is that dental pain. So it's kind of, those different things all interact. And I think that it increases the symptoms of depression and anxiety specifically. I haven't really delved into, but I am curious with even the self-harm, if your self-esteem is down, where they go to a coping mechanism of that. So that's what I would say, where you see that correlation at.
I think it's one of the fascinating things, and we've done a couple of shows about this, about how so much of what we're talking about in the past had been sort of siloed, where it's like, well, this is a child with anxiety issues, without saying, well, it's a child with anxiety issues we're starting to say, well, look at the trauma that they've suffered in their lives and how does it, but to turn and say, but you're also talking about a child who, nutrition, sleep, oral care, all these things are all, we've got to start looking at this more of like the machine is all interconnected, I think.
Exactly, absolutely.
And I think you alluded to this, but I was really interested when we talked before. I can imagine that the kids are like, sometimes they're really surprised about how you've eased their pain. Has that happened?
Yeah. And I can tell you that is the best part of my job. It's truly, when tooth pain is one of those excruciating pains, crawl in the ceiling pain. So when you have a kid coming in and they're holding their mouth and they just are so incredibly uncomfortable and they are hopeless at that point. And the other issue, so they're coming in with pain, but who are they coming to? The big scary dentist, right? That's what we're portrayed as in the media. So not only am I in pain, I'm going to go to someone that's probably going to also cause more pain. That's what they're thinking. That's the narrative that they've heard. So it's very important, again, when you bring them back to say, we're going to put that numbing gel on their area where it's hurting. And I say, I'm completely direct with the kids. And I say, we are going to have a little pinch. I cannot take every sensation away, but I can make it feel better. I'm going to jiggle your cheek. We're going to distract away from it. It's going to be a pinch, and I absolutely know that you can do it. I can do it. You can do it. I always say that. And truly, the best thing, it's like the best compliment as in the world to a dentist is when you sit them up after giving you Novocaine, you instantly took their pain away, right? And they say, is that it? Do you have to give me any more Novocaine? And do you give me a needle? And I'm like, no, that's it. You got through the worst part of the procedure. Now it's home free. Like, it's easy sailing at this point. So, that feels really, really good. And then once you take care of the source of the infection and you take that pain away, the weight has been lifted off their shoulders and the brightness is back in their eyes. They're no longer sad or upset holding their face. So I feel as a dentist, like you feel like you have, you perform magic almost. Because how many people can say they can instantaneously do something to take that pain away? A lot of times it's there for a while. So that's definitely one of those moments, and it feels really, really good. I don't know a dentist that you can't ask that doesn't make you feel good to be able to provide that to someone.
That's wonderful. We ask each of our guests for a life hack, favorite saying, memorable quote. Maybe it's just something, and it doesn't have to be dental related. Although we'll take the tips or whatever that you have for us. What's your life hack for us today?
So when I was 14 years old, I had a teacher tell me, carpe diem, seize the day. That really stuck with me. And truly, I get up every morning and I seize the day. But the one thing that I have learned, you don't have to go 110%. It does not have to be perfect. Make sure it's sustainable. If you're 1% better than you were, I've read that in a book called Atomic Habits, than you were the day before, you're going to have a positive influence on your life. And as a result, it's also going to be positive impact on those that are surrounding you. So carpe diem, seize the day, but make it in a sustainable way.
Fantastic. Dr. Andrea DiPaul is the dentist for our residential treatment programs at our Orchard Hills campus here at KidsPeace in Orfield, Pennsylvania. Dr. DiPaul, thank you so much for joining us.
You're welcome. Thank you for having me.
And thank you all for joining us as well. We look forward to having you join us again for more conversations with KidsPeace. Until then, take care.